Top stories from around the island. To the point. Without the fluff. Puerto Rico headline news. Please subscribe and don't forget to hit the bell notification.
Hello and welcome to Puerto Rico Headline News for April 1st, 2020. If you haven't subscribed yet to this channel, please do so, like this video, and don't be afraid to share this content with friends and family, especially those that live here in Puerto Rico and do not have any access to any English-based news. So let's go ahead and cover, we have the latest information on the COVID-19 update here in Puerto Rico. I'm also going to cover some additional information on contact tracing that is set to begin in Puerto Rico today. So let's go ahead and enter this article. Here we see for the first April 1st, deaths have now increased to 11. And those that are confirmed cases has increased to 286, and we're still waiting on 897 test results. So let's go ahead and enter this article. We have some, there's some fantastic graphs that will also are going to cover that'll help us with the situation here in Puerto Rico. So it says here, the death toll from COVID-19 coronavirus in Puerto Rico rose to 11 this Wednesday or today after the health department confirmed the death of another man and 2 women from the coronavirus, from this disease. Likewise, the number of infections, it reached 286. 47 more confirmed cases than those reported yesterday. It was reported that 11 of these new confirmed cases were processed by the Department of Health's laboratory, 2 from the Veterans Hospital, and 34 in private laboratories around the island. Now, of the total positives that we have so far, 150 are men, while 136 are women. The information provided by the Department of Health maintains that the most recent victims of the virus resided in the metropolitan region and in that of the Bayamón area. Now, the 17-year-old man had overcome the virus at the time of his death, but his clinical assessment was complicated, or had complications. Meanwhile, the 2 deceased women were 86 and 68 years old, respectively. They underwent the test after they had already died, since they had presented, they had signs of symptoms associated with the coronavirus. And so that's what happened in that case. So here, we're going to move on to these graphs that are really helpful for us. So here, this map is showing us the concentration or the clusters of confirmed cases in Puerto Rico by municipality. So it says here, up till now, the municipality that has the most confirmed cases is San Juan, and there we're able to see it in dark red. And it's followed by Caguas and Guaynabo with 16 cases. And even though the Department of Health currently doesn't have information on 120 other patients and where they are from, but from the information that they do have, this is what it looks like. And if you compare this map with the one from yesterday's video, we can see that it's starting to increase as testing increases. We see how it's a lot more municipalities are also reporting confirmed cases of the coronavirus. For the time being, it's concentrated in the San Juan metropolitan area. So if you are in these areas, please take special care. Now here's another graph that gives us a better picture of the age groups and the concentration of the coronavirus depending on age. So here we can see from 0 to 29, there's 38 cases. 30 to 39, there's 36 cases. 40 to 49, there's 57 confirmed cases. And the highest concentration is in the age group between 50 and 59. And those amount to 65 confirmed cases so far. And then it goes back down between 60 to 69, there's 44. 70 to 79, there's 27 confirmed cases. And then sadly, in the 80 plus area, there's 19 confirmed coronavirus cases in that age group. So certainly the information that's recently come out, this does affect all age groups, but especially those in the older age group, and if you have conditions, health conditions that are unfavorable to your health. So let's move on to another graph that's been provided by the Department of Health. And this is just to get a visual look on the amount of cases that exist right now or that are in Puerto Rico. So you see this orange, yellow type looking line. These are the cases that we are waiting for test results on. So you see there, it's close to the 800 that we had mentioned that they're still waiting on. Then you have the confirmed cases in red. You have the blue line as far as recovered cases, and from as far as I know, there's only been 2 that have recovered, and then we have the death line there as well. So we'll move on to the following graph, and this gives us another look at the confirmed cases that are pending, 897 compared to 1,409 cases that have come back negative. Positive are 286 so far, with 11 deaths and 2 that have recovered. And we're gotten used to seeing this graph here, the amount of positive or confirmed cases in Puerto Rico. And here we see the trend, the incline or the trending up on the amount of confirmed cases. And of course, this number will continue to go up. I have some information from the newly appointed Department of Health secretary with additional information on what he sees for the future as far as reaching a peak here in Puerto Rico. So we'll cover that in a few minutes as well. Like I mentioned at the beginning, I wanted to cover some information that was released by the newly appointed Department of Health, Lorenzo González, regarding his outlook on the coronavirus projections and when he sees there might be a peak, and also some additional information on the contact tracing that he says will begin today. So I'm going to go ahead and cover this article and explain a little bit on what's going on here. It says the Secretary of the Department of Health, Lorenzo González, indicated that starting today, Wednesday, the agency will begin to organize the tracking of positive cases for the coronavirus COVID-19 to establish a clearer projection of when the peak of infections could be in Puerto Rico. Now, González indicated that so far there are preliminary estimates that point to May 8th as being the peak here in Puerto Rico. Although in the United States, it looks like their peak is looking to be around April 15th. Here in the island in Puerto Rico, he's projecting, based on the information that he has now, as May 8th being the peak here on the island. Now, in any case, the official pointed out that the estimates available to date need to be validated by the tracking of the confirmed cases or contact tracing. So once that data starts to come in, starting today, he'll have a clearer picture to be able to give an estimate on what the peak might be here in Puerto Rico. And the article continues to mention that, however, González is sure that the worst time has not yet come. So we're trying to get through this, but the worst is yet to come. He continues to mention in this article that the important thing is prospectively to continue with social distancing. So he wants to continue and make sure that we continue to do that. Now in the health department, we are going to try to identify those positives or those confirmed cases and the contacts they may have with other people, and keep them under observation to make sure that they do not make us sick first, and if they do get sick, that they do not infect other people. So he has a nice plan to do this contact tracing. The article continues to mention, given the reality that health has few personnel, González explained that they will redistribute the existing workforce or personnel that they have that works in different areas of epidemiology to concentrate the majority on working with COVID-19 and the contact tracing. So he's shuffling around personnel that exists within the government, especially in the epidemiology department, to move and work in this contact tracing to have enough people out there being able to track down the contacts that confirmed cases have come into contact with. And he mentions students from the School of Medicine will join the work teams, which will be under the direction of the new state epidemiologist. We contacted Dr. Capo, who is an epidemiologist, who will be the person in charge of the health department. He will be working directly with Dr. Reyes of the task force to generate the teams and with Dr. Marquez, is what Gonzalez said. So certainly this is good news. They're taking immediate action to begin this right away. He said that this morning that they should start receiving data today, and certainly in the next 24 to 48 hours they'll have everything in set and plan to make sure that along with this lockdown that Puerto Ricans here are enduring, that contact tracing is also done, and that will further be able to flatten the curve and reduce the amount of confirmed cases here on the island. And certainly the sooner we're able to do that, the sooner we are able to go back to our normal lives. So certainly something very positive. Again, this is the new Department of Health Secretary, Lorenzo González. He's also done a few interviews with David Begnaud from the CBS News, and very impressive, easy to understand, and he has a lot of plans in place, and he's very aggressive toward ending the coronavirus infections here on the island. So that was your COVID-19 update for Puerto Rico here on April 1st. Again, please don't forget to subscribe to this channel. Hit that bell notification so that you're notified whenever I do release a new video. And again, please share this content with friends and family. There's also a Facebook group, Puerto Rico Headline News, that you can join, and there will be additional information there as well. Thanks again. This is Puerto Rico Headline News.